Hi, my name is Angela Bradford. I'm a registered and licensed dietitian, and today I'm going to be talking about behavior change theory and motivational interviewing. Objectives of the presentation are to inform on how the combination of behavior change theories can be utilized to promote behavior change, and to discuss how motivational interviewing complements those behavior change theories. Behavior change is defined as conducting oneself differently in some particular manner. The goal of nutrition counseling is to help the client make positive health behavior change with whatever change is beneficial to each individual client. The counselor's job is to share with the client knowledge about what options they have to achieve those goals of behavior change. Health behavior change has been found to correlate with strong self-efficacy. Self-efficacy is defined as an individual's confidence to perform a specific behavior. We want clients to be motivated that they can make these changes because we've helped them realize the knowledge that they already have and provided them with information on tools to help them achieve those goals, whether the tools be more knowledge on the health changes or things that can assist those changes, like an application that helps them track their steps, or a water bottle that has an alarm to remind you to drink your water. A combination of health behavior change theories can be used to inform a counseling session. I have experience using the social cognitive theory with the trans-theoretical model to guide the design of the intervention, all while using motivational interviewing to help guide the conversation. So social cognitive theory, like I said, is what I have experience using. This is an interaction between personal, behavior, and environmental factors that it highlights. This theory presents that a change with one of these actions can influence the other factors. For instance, if the client buys healthier foods or foods recommended to them according to a specialized diet like diabetes, they'll be more likely to eat those food, which is a behavior change. Or if the client were to stop buying ice cream for the house, then they would be more likely to eat less ice cream because they don't have it available in the house. These are examples of environmental changes that affected the behavior, which could affect the personal by causing them to like those healthier foods and want to try different types. Some examples of learning strategies. There's different learning strategies that can be used to promote the behavior change with the social cognitive theory. And one is cooking demonstrations. Those cooking demonstrations can provide nutrition and food knowledge to the client by showing them an actual skill in action to help perform a positive behavior. Showing them how to cook with different foods could motivate them to buy those same foods now that they have that learning skill. This type of observational learning asserts that people can witness and observe a behavior conducted by others and then reproduce those actions. Another example is announcing the client's success to other clients if given permission by that client. Some clients like to be recognized for their efforts. For example, I would do this with dialysis patients because some of them like to celebrate that they've been controlling their fluid intake because it's very difficult to do that, to only drink a certain amount of fluid every day. And so we're celebrating that amongst their peers. That recognition gives them motivation to continue with their positive change. Another is enlisting other successful clients as a positive role model, and another is another strategy. Having that support group and encouragement from someone who has been able to achieve those same goals the client might have is motivating. It's a personal factor that changes because now that they have someone who has done it, it can motivate them to make that change. There's different strategies that can be used. These are just a few examples of what can be done with this theory. As I noted earlier, using the social cognitive theory with the trans-theoretical model is a good combination with promoting change. The trans-theoretical model, also known as the stages of change model, focuses on the decision-making of the individual and is a model of intentional change. The model describes behavior change as a process of passing through a sequence of motivational stages that are characterized as levels of readiness to take action. So I have here a photo on the right side of the slide that depicts the different stages of change. And the first stage is pre-contemplation. People in this stage don't tend to take action in the foreseeable future, which is within the next 6 months. People in the stage, they often underestimate the pros of changing their behavior. And in the next stage, a person might be in contemplation, which is they're intending to start the healthy behavior soon. People recognize that the behavior might be a problem and are willing to really consider the pros and cons. Even with this recognition, people may still feel uncertain towards changing the behavior. In the preparation stage, people are ready to take action very soon. Within the next 30 days, really, people start to take small steps towards the behavior change. They are doing things to get ready for the change, like setting up appointments with a nutrition counselor. And I say that, but don't think that means because if you're a nutrition counselor and you're seeing the client, that this client must be in the preparation stage. Talking to the client to assess what stage they're in is very important to help guide their interventions, and using motivational interviewing will help assist with determining what stage the client's in. And I'll talk about that more in the next slide. The action stage. In this stage, people have recently changed their behavior within the last 6 months and intend to keep moving forward with that behavior change. People may show this by changing their behavior, acquiring new healthy behaviors. The maintenance stage, this is when people have been keeping to that behavior change. They're sustaining that behavior change for a while, defined as more than 6 months is what a while means. And they intend to maintain the behavior change going forward. People in this stage work to prevent relapsing into the other stages, like falling back into action or preparation. But that is possible. The clients can shift between the stages, and then also clients can enter and exit at any stage. So they might not start off at pre-contemplation. They might start off at preparation when you're talking to them, or they could start off at contemplation. That's something for you to determine when you're in that counseling session with them, using that communication method that we'll talk about in just a moment. The trans-theoretical model can be used with social cognitive theory. For example, depending on the stage the client is in, that helps guide you, the counselor, to what type of intervention to use from the social cognitive theory. If you're counseling a client already in the action stage, you'd provide them with more of the support groups of those enlisted patients that they've been successful with that change, or you would praise them to other clients if they gave you permission to do so. The interventions could change depending on the stage of change they're in. And it should be understood that clients might go back and forth, like I said earlier. Also, the client may be at different stages of change for different health behaviors. So if you have a dialysis patient, for example, that has excellent phosphorus labs, but their potassium lab is really high, they've changed their eating behavior for the phosphorus, but for the potassium, they're not ready to stop eating oranges. There's an opportunity to praise the phosphorus because they're in that action stage. They might even be in the maintenance for phosphorus, but they haven't changed yet for the potassium. So maybe the counselor can do a cooking demonstration or a taste testing for the potassium foods. Motivational interviewing. It's a collaborative, person-centered form of guiding to elicit and strengthen motivation for change. Motivational interviewing is not a behavior change theory. It's a communication method. that can be used with other theories to attain behavior change. The whole exchange between the counselor and the client should be a conversation instead of the provider waiting to talk, which will help build more trust with the client. That trust will help the client open up more and share their experiences and how they really feel they are with whether they want to change right now. And so that motivational interviewing can help determine what stage of change that the client is in. And then whatever stage they're in, you can use that to decide on what intervention to use, whatever's best for that stage. Something to note is that motivational interviewing is the professional showing empathy to the client. They're really actively listening to what they're saying, what the client is saying. They're not judging them for anything that they're telling them, any practices that they're doing. And you're really motivating them to encourage them to use that change talk, those kind of statements that are signaling that they're ready to change or they have some type of motivation to change. You want to reinforce that. And depending on what stage they're in, motivational interviewing could be more successful. So you don't really want to use motivational interviewing in the action stage, because the whole point of using the motivational interviewing is getting the client to the action stage. So it'll be more successful in like a pre-contemplation, contemplation, preparation kind of stage, something before action stage. So in summary, positive health behavior change is the goal for nutrition counseling. The social cognitive theory and the trans-theoretical model can be used together to be the basis of the learning experience. And motivational interviewing is beneficial to use with both of these, and with the social cognitive theory and the trans-theoretical model, to help promote a healthy behavior change. Here are some of my references. Thank you for your time. This concludes my presentation.